Thank you, RJ. We're blessed to have you too. RJ has his own distinguished career of making sure that faith communities all across the U.S. and even Japan had access to mental health services. And this kind of room makes me really happy because it's the community coming together to do something. Jerry, thank you so much for opening up Hope Center for us and being pioneers around redeveloping this whole part of town. There's still a lot of work to do, and we're looking forward to working with you on that, so thank you. So, and our board members, I have to tell you, I have the smartest, brightest, sorry, Jerry, board. Yeah, I mean, it's unbelievable, and they do so many things for us that are just very, very meaningful. You know, they open doors around our mission and vision to other people that are interested in helping us achieve that dream that everybody who needs access to mental health in Denver gets it. And, you know, when you were talking about us being big, you know, it's not about being big. It's about people getting services. And whether we do it or Hope Center or Sisters of Color, Girls Inc., it doesn't matter who does it. If people are getting it, that's what we want, and that's our dream. And coming together like this really makes it happen. And I just want to thank the board members for introducing us to people that really help us make a difference around that and bringing your expertise in here. So we have a lot of partners that we work with. I'm going to talk about some of them, and I am going to mention our donors because they make a huge difference. You know, we couldn't do everything that we do in mental health if it wasn't for the donations that we get that give us the flexibility to do things that are beyond what you usually get in the healthcare system. And those kinds of flexibilities make all the difference. We've been able to use donation dollars to demonstrate projects that have then had ongoing funding because we were able to show the difference they made. We are very big on measuring everything that we do. We love measuring outcomes. We love showing people when they're better. We love being able to connect and show the community that spending dollars here make a difference. And our research and evaluation department are second to none. So I want to talk a little bit about accomplishments. My mom would bust my chops on this because she would say I'm bragging, and she doesn't allow that in the family, although she brags. and that part's okay. So I almost wish she were here doing the bragging, but here's the thing. When we opened the Recovery Center, which is on 12th between Birch and Claremont, we opened that in July of 2012. We had 4,000 people going to that clinic. Now we have 5,000 people going to that clinic every day. And it's not just about the people that are there today. It's about people getting better. And when people get better, we measure that. They know it. We know it. And the real thing is that as they get better, they don't need us so much. And that's terrific. They're out in the community having their lives, the lives that they dream about and that they want. And as they need less of us, we have room for more people. So when I look at like the whole pot, every year we've been able to serve more and more people. And last year we served, and this is always interesting when you count people because everybody has a different idea about what that number is, 37,800 people. And that is like over 7,000 more than we served the year before. And a lot of it has to do with the help we got of opening up the Recovery Center. Now, opening up that opened up capacity, it opened up space. On our child and family side, we haven't done that part yet, and we are out of space. And despite being out of space, our child and family team have figured out how to see more kids and more families. And it's 7% more than it was the year before. And I think that's phenomenal. And that's Dr. Lydia Prado. So we do believe in going to where people already are. And to give you an example, we've had a long relationship with Urban Peak. Urban Peak is a program for homeless young people, and They have a lot of mental health needs, and we've had a licensed social worker in that clinic for over 15 years. And so if there's a place where people are already going and we can get there, that's what we do. We've been embedding our folks in primary care clinics. A lot of folks don't go to a mental health center when they have a mental health issue. They go to their primary care doc. And many primary care docs are so busy in their clinics, they don't often have all the time they would like to address the mental health needs. So we've been embedding our folks in Bruner Family Medicine and family practices and Denver Health Clinics. And by doing that, more people get access. And our model is, if our folks that are there, they know a lot, they do a lot, they don't need to know everything. And if they run into somebody that needs more, we're their backup system. We're there for them to do the other kinds of services they might need. Rocky Mountain PBS this year was a big supporter around us helping to get the word out about what makes a difference in kids' lives. That was through the town hall. And certainly our relationship with Mile High United Way, which I know is a partner for you here at Hope too. So what is keeping us as I like to say, the National Center of Excellence, not a center, the center. A part of that was seeing more people. You know, we work very hard every day to think about how can we see more and more folks, and we've seen more adults and more kids and families. We were named Large Nonprofit of the Year last year by the Metro Denver Chamber, and that felt like a great honor. We were picked as one of the top places to work by the Denver Post. And our brand awareness campaign that we've been working on is to help the community know that, you know what, mental health issues happen. It's 1 in 5 people at any given moment, 1 in 4 people over the period of a year. And so we have a very quick video that we're going to show that is a part of that campaign to get the message out.
Mental well-being is the foundation of physical well-being. Without proper mental health, we suffer. Even seemingly minor issues left untreated can lead to serious problems. Lives can unravel, and it's more prevalent than you might think. 1 in 5 people face mental illness of some kind. It's more common than cancer, diabetes, or heart disease. For some, the cause is biological. For others, it can be related to traumatic life events, abuse and neglect, war, witnessing violence, natural disasters, physical illness, grief and loss. It all plays a part, and kids are not immune. In fact, children under age 6 have the highest unmet need for mental health services. So what do? We start with the individual. At the Mental Health Center of Denver, we find the right treatment to meet the needs of each person. We focus on prevention, early detection, and intervention whenever possible. And we have programs and partners in place to meet the challenges of homelessness, unemployment, addiction, depression, and difficult medical conditions, offering guidance on the path to recovery. We work with children and parents to strengthen families. We reach them wherever they are, in schools and early education sites, in pediatric offices, and in their homes. We're in more than 60 locations across Denver, and our efforts are paying off. For every dollar spent on care, we save taxpayers $7. Most importantly, Mental Health Center of Denver is leading the nation with a 75% success rate, helping individuals lead healthier, more productive lives. And for every individual we help, there's a positive impact on many. Healthy adults create stronger families. Stronger families empower children to thrive and become better students. We give people the chance to live richer, more meaningful lives. Stronger communities are built on a foundation of mental wellness. When we all work together, we weave the fabric of a healthy, thriving community.
We just want it to be okay for people to talk about what's going on. We're changing the language. When someone's dealing with a mental health issue, it's not what's wrong with you, it's what happened to you. And there's a lot of things that happen in people's lives. Trauma has a big impact on people's general mental health. So one of the things that we're a part of is a national group that's looking at trauma-informed care. And what that's about is how do we deliver our services in such a way that does not re-traumatize people. There are a lot of principles that are involved in that. There are a lot of things that people do every day to help themselves feel better that you can interrupt in a bad way if you're not thinking about that when you bring people into treatment. So just to give you a small example, if you would go over to the recovery center right now, you wouldn't notice this walking in. It has a very good feeling about it, and some of the things that contribute to the good feeling is the fact that we do not have any no signs on the building. And most of healthcare, you see no signs everywhere. They're telling you what not to do when you're in a state of sort of like not feeling great and wanting to know what you can do. So that particular building also got a LEED certification, platinum level, which is fairly remarkable. Our staff are very into being green, and that was a very important aspect of that. And we are the only platinum LEED mental health center in Colorado. Actually, there's only one other in the country, and we're pretty proud about being able to contribute it that way. So we had about 500 staff members over a year ago, and now we have 580. We're always looking at how we can expand our services around helping people enrich their lives and minds. So with this, my executive management team, I don't do this by myself. It takes a whole team. I give my credit of success of hiring people that are smarter than me, that know how to do things I don't know how to do, which I greatly appreciate. So if you guys would raise your hands, I'd greatly appreciate it. So we've made big steps around expanding capacity around our adult services, and now it's time to take the next great big step around our child and family services. We have a terrific leader in Dr. Lydia Prado, who's going to share our vision of our next steps. So, Dr. Prado.